Hello everyone, welcome back to my channel guys. So today I'm here to discuss another high yield topic for students preparing for USMLE and NEET PG exam, and the topic is an endocrine hormone prolactin. So I have made 3 slides guys. In the first slide I'll be talking about the pathway of prolactin. In the next slide I will talk about all the high yield information you must know about prolactin hormone, and last slide I have made a multiple choice question related to this topic. So try to watch the entire video, do not skip it. And guys, one important information, that how will I know if my videos are helping you? Only if you like, share and subscribe, right? So don't hesitate to do that guys if it is helping you. Okay, and if you have any doubt, let me know in the comment section. Okay, so let's discuss about this important hormone prolactin, which is actually released from the anterior pituitary, and dopamine, which is released from the hypothalamus, inhibits the release of prolactin, and thyrotropin releasing hormone stimulates the release of prolactin. Conditions like hypothyroidism, where there is an increased thyrotropin releasing hormone, that will go and stimulate the release of prolactin. Now, in conditions like renal failure, where there is a reduced elimination of prolactin, okay, so its level will go up. Prolactin also stimulates the breast tissue to produce milk production, especially in lactating women. Okay, so prolactin, when it is high, especially in conditions like prolactinoma, it can suppress the gonadotropin releasing hormone, and that will suppress follicle stimulating hormone and luteinizing hormone, so which we'll talk in detail in the next slide. So important facts we should know about prolactin guys. It's very important to know that prolactin is structurally similar to growth hormone. The level of prolactin in males is less than 17 nanogram per ml, and in female it is less than 25 nanogram per ml. Okay, and prolactinoma, oma is a tumor, benign tumor. Okay, so it is a tumor of the anterior pituitary, as prolactin is released from the anterior pituitary, and it's when the level is super high, you see more than 200 nanogram, so you can suspect prolactinoma. And patients having prolactinoma, they can present with headache. Why headache? Because uh, these pituitary tumor can stress the meninges and they can have headache. And why visual field defects? Because this pituitary tumor, they can compress the optic chiasm. What is an optic chiasm? Where the optic nerve are crossing, right? So that is why when this tumor is compressing the optic chiasm, they can have visual field defects. Now, in female and male, the manifestation of prolactinoma is, in female they can have galacturia, because prolactin stimulates the breast tissue to cause milk discharge, right? Why amenorrhea? As we saw that the prolactin inhibits the GnRH, so that will inhibit the FSH and LH, so there is no release of estrogen, and there is no release of estrogen, so that will inhibit the ovulation, and that will lead to amenorrhea. Estrogen causes, when there is less estrogen, that is another reason that it can cause vaginal dryness. Okay, why brittle bones? Estrogen normally causes bone formation, that is osteoblast formation, but when there is less estrogen, then that will lead to bone destruction and fracture, right? So similarly in males there is a gynecomastia, because as we saw that when there is more prolactin, that will suppress the GnRH, that will suppress FSH and LH, and then there will be less testosterone, and that will cause gynecomastia. Less testosterone also causes erectile dysfunction, right? And both male and female, it can cause infertility and decrease libido. Now, when a patient has a prolactinoma, what imaging you can do? You can do an MRI of the pituitary gland. Now, in the multiple choice question in the next slide, we'll discuss in detail about when should you go for a medical or a surgical treatment. Okay, that's a high yield topic again. Now, the treatment for prolactinoma you give is dopamine agonist. Why do you want to give dopamine agonist? As we saw in the previous slide, dopamine inhibits the release of prolactin. That's why drugs like cabergoline or bromocriptine can inhibit the secretion of prolactin. As a result, the prolactin level will go down when you give dopamine agonist. Now also it is important to know that antipsychotics and metoclopramide. What is metoclopramide? It is an antiemetic drug. Okay, both are dopamine antagonists. So when there is dopamine antagonist, it cannot suppress prolactin, right? It will rather stimulate prolactin secretion. Dopamine suppresses prolactin secretion. Dopamine antagonist will stimulate prolactin secretion. So that's important to know. Now, other high information you should know is that during delivery there is a fall in the estrogen and progesterone, okay, and that will increase the prolactin secretion. So it really makes sense that after delivery the woman is preparing for the lactation, right? So the prolactin secretion will increase, right? Now, what is samoma bodies? And actually this is an histological diagnosis, and this is nothing but a concentric laminated calcification which is seen in prolactinoma. It is also seen in papillary carcinoma of the thyroid and few other condition, guys. Please let me know in the comment section. Okay, and let's now discuss the multiple choice question. So let's say that you have a patient. So let's highlight the important points, guys. Okay. So a young male, 25-year-old young male presenting with headache. That's a positive point, especially in the morning. Vital signs are stable, and he also complains of reduced peripheral vision. Okay. So the peripheral vision is reduced. So let's highlight this one. And recently observed white nipple discharge. Okay, so that may be galacturia, and peripheral vision is reduced, and MRI shows a tumor less than 10 millimeter in the pituitary fossa. What is the treatment in this condition? So the vignette is directly telling us that patient with headache, right, reduced peripheral vision, and then white nipple, this is galacturia, pituitary tumor. Okay, and what is the treatment? So it can be a prolactinoma. Okay, one of the differential diagnosis is all the pituitary tumors you can think of, but why I'm thinking of prolactinoma, the nipple discharge, right? And then pituitary fossa, the prolactinoma is a tumor of the pituitary gland, right? So what is the treatment? So is it hormonal therapy, it is surgery, or bromocriptine, that is dopamine agonist, or dopamine antagonist like metoclopramide? Before we pick the answer, guys, let's understand the treatment. Okay, now once we suspect that the patient has prolactinoma, then you will do the MRI of the pituitary gland. And let's say the patient does not have symptom, but the tumor size is less than 10 millimeter, then you don't have to treat the patient. But if it is less than 10 millimeter and the patient has symptoms, or if it is more than 10 millimeter, then you go for treatment like dopamine agonist like bromocriptine or cabergoline. Most of the time prolactinoma is suppressed, the size is decreased with medical treatment. Okay, surgery, it's very rare to do surgery in this condition. Okay, when you go for a surgery like transpenoidal surgery, if the medical treatment fails, or if the size of the tumor is more than or equal to 3 centimeter. Now let's go back to this vignette. Here the vignette says the tumor size is less than 10 millimeter, but the patient has symptom. So if there is no symptom, then we could have gone for a no treatment. But the patient has symptom and it is less than 10 millimeter. So obviously you will go for a dopamine agonist like bromocriptine here, right? So why you will not go for a metoclopramide? Metoclopramide is a dopamine antagonist that will worsen the situation. You cannot go for a surgery. First you will try the medical treatment. If it fails, then you can think of surgery, and surgery you will only think if the size is very large, 3 centimeter, right? And hormonal therapy. Prolactin itself is a hormone, guys, okay? So it will again worsen the situation, right? So guys, today we discuss about the pathway of prolactin, how prolactin is released from the antipituitary, and how it is regulated by, inhibited by dopamine and stimulated by thyrotropin releasing hormone. Okay, and also we saw that what are the high yield points we should know about prolactin hormone. Okay, and we saw this important vignette, and it's very important to know this treatment, guys. Look at the vignette. The patient has symptoms or no symptoms, and accordingly pick the correct answer. Okay, so guys, I hope that this session helped you, and I mean the video helped you, and if there is any specific topic you want me to make video on, let me know. Okay, thank you so much, guys.